Well, my name is Sean Lewis, and I had full knee replacement surgery on August 16th, 2016. I had an injury from basketball, and a doctor over in Japan looked at my knee, and he found that I probably needed to have arthroscopic knee surgery, and he went in and pulled out a small chunk of bone that had broken off behind my right kneecap. And on further examination of things, he did say that you will at some point need to have full knee replacement surgery, but he recommended, because it was so extensive, that I have it done back in the States. Frankly, I suffered, and I avoided using my legs and knee, and I stopped virtually all exercise. I mean, it got so bad that a light would change and I'd be halfway across the street and I couldn't, get into a jog to get across the street before the light had turned red and cars would honk at me and that kind of thing. I mean, it was that bad. I couldn't use my legs. I played golf over in Japan prior to the surgery, 4 or 5 years ago, 3 years ago kind of thing, and I had tremendous pain, and I was miserable. It wasn't fun. I wasn't playing well. I wasn't able to do much of anything. I wasn't able to hike. I wasn't able to, even international airports, I've got long walks, and it wasn't fun, to be able to get around. I wasn't able to do anything. Standing, was not comfortable. I went in and did consult with Dr. Zenos, and he took a look at the MRI that I brought over from Japan and the x-rays that I brought over from Japan. And he looked at things and said, oh, absolutely, you have to have full knee replacement. Having the opportunity to use the newest technology, like a tourniquetless system, was appealing to me. To be honest with you, once he explained the system to me, I didn't think twice about it. I didn't have any questions. I didn't, no, put a belt on my leg and strap it as tight as you can, do that. No, I'm okay with that. So having a speedy recovery was essential for me, and the tourniquetless system absolutely provided that to me, I think. I travel extensively. I travel nearly monthly on an international, to Japan or other international destinations, and I received a waiver from, I received instructions from Dr. Zenos, and I traveled exactly 3 weeks after my surgery. So PT, we started off with the flexation. They wanted to obviously see how far I could get in my flexing, and I got to, I want to say it was 120 degrees. She told me faster than any patient she'd ever seen. And I had a couple of other PT guys come over and work with me, and they would say the same thing. The flexation was absolutely amazing. I think that I played golf in November of that year, and I really wanted to get out, and I kind of pushed it a little bit and got around, and it really, I was driving the cart, didn't push it too hard, and it was fun to get back out and be able to do that. Actually, I posted 20 rounds, and I probably played about 25 rounds of golf this summer, and I would say about, I don't know, probably about a third of those, maybe let's say 10 rounds. I've walked. I don't carry my bag, but I do put the bag on a pull cart, and I will walk the 18 holes. I played yesterday, as a matter of fact, and then we had our workout today, and I have there's no soreness in the knee. Frankly, my left knee is more sore than my right knee. So my right knee was the one that I had the surgery on. To be honest with you, it sounds like a small goal, but it was a pretty big one for me, to be able to get across a street when the light is changing. I mean, there 3 or 4 times I was caught, and it wasn't uncomfortable. It was a scary situation. So I felt like a decrepit old man, and I'm not. So I'm back to not being a decrepit old man. That's a happy thing.